When I ended the lecture, the 13th lecture, I told you that in the next lecture we'll see the blood tests which are performed, the physiological factors affecting the plasma iron concentration, and what are the conditions which are related with, which are associated with iron deficiency. So the blood test, first portion of this lecture is based on the blood test and the total iron binding capacity, TIBC, is a blood test to see the amount of iron in the blood. And it is the normal range is given here, and you can see the conversion factor is also there, that is the microgram is converted into micromole per liter. Serum iron in males, it is 65 to 177 microgram per dl, whereas in the female, it is 50 to 170 microgram per dl. Female, obviously, they have low iron content because due to the menstrual cycle, their iron is removed from the blood. Unsaturated iron binding capacity. The total iron binding capacity is the total iron binding capacity, TIBC is the total iron binding capacity and equals to the unsaturated iron binding capacity plus the serum iron measurement. Here you can see that the total iron binding capacity, it means that the iron is not fully bounded, unsaturated, right? There is a capacity to absorb more iron. So when we add the serum iron to this, then you get the total iron binding capacity. Unsaturated means that all the iron has not absorbed. So when you add the serum iron to this unsaturated iron binding capacity, then you will get the total iron binding capacity. So what is the unsaturated iron binding capacity? It measures the what UIBC stands for. It measures the unsaturated iron binding capacity of transfer. Since iron moves in blood combined with transferrin, why we say that it is the transferrin capacity of the transferrin, because the iron moves in blood in combination with transferrin, and then it is taken up by the transferrin receptors which are present on the cells, but through the blood the iron always in the ferric form, it moves combined with the transferrin. So transferrin is a transporter of iron in the blood. It means that the diagnosis should be based on both the factors. How much transferrin is present, that is how much the exporter or the transporter is present in the blood, and how much iron is present. When you measure or calculate both the things, then you will come to know the total iron binding capacity. What is transfer? How it can be measured? You know that what is transferrin, but transferrin is the exporter which transport iron from the blood to the tissue cell, and you have seen it in the last lecture, it transport iron in the ferric form. The normal range of transferrin is 170 to 370 milligram per dl. Higher value indicates iron deficiency anemia, because you see transferrin is present, where level of transferrin is high, but iron is not present to bind transferrin, right? And therefore, since iron is not present to bind transferrin, unbounded transferrin level will be high. Unbounded transferrin level will be high in iron deficiency anemia, because iron is not available to bind transferrin. Transferrin may also be measured using a value called total iron binding capacity. Transferrin assay. If transferrin test is not available, right? If the plasma transferrin analysis test is not available, then its concentration can be assessed by adding the excess of inorganic iron to the plasma unbounded protein. You see, there is a unbounded protein, right? Unbounded transferrin. Moreover, unbounded iron protein or unbounded transferrin. Then when you add excess of iron, then this transferrin will bound the iron and you will get the amount of the bounded iron. This bounded iron is then assayed and the result is expressed as a total iron binding capacity, and this will measure the transferrin concentration. You got the concept? See, transferrin test is not available, right? And this is the unbounded transferrin, right? See my pointer, unbounded transferrin. So, when the excess of iron has been added, this will be bounded to a transferrin and this will indicate the total iron binding capacity, and in this way the transferrin can be measured by assaying the total iron binding capacity. Low transferrin level can be due to poor production. There are many cases, there are many factors which are related to the low transferrin level. It may be due to the poor production of transferrin by the liver or excessive loss of transferrin through the kidneys in the urine. So there are two factors you can say which can lead to the low transferrin level. Poor production of transferrin by the liver, number one, and number two, excessive loss of transferrin in urine. Many conditions, including infections and malignancy, can depress the transferrin level. High transferrin level. The transferrin level is abnormally high in iron deficiency anemia. I have already told you that transferrin is present, iron is not present. So, unbounded transferrin level will be high. A high level of TIBC higher than 400 to 450 microgram per dl because iron stores are low. I have just told you that the higher level of TIBC will be there, higher level of the transferrin will be there because the iron is deficient and therefore transferrin is not able to carry the iron. Unsaturated binding capacity will also be there because iron is deficient. Iron is not able to bind transferrin and therefore the unsaturated iron binding capacity will be high. I'll go back to the slide. Here you can see unbounded iron capacity, unsaturated iron binding capacity will be high and the transferrin will be high, and obviously if you add excess of iron then you can see the bounded TIBC will be increased. So when iron is deficient, basically transferrin and unbounded transferrin will be high. Transferrin saturation. Male, it is 20 to 50%. In the female, it is 15 to 50%. This value tells a clinician how much serum iron is bound. Obviously, saturation की हम बात कर रहे हैं. किसी भी चीज़ की हम saturation की बात करते हैं, it means that it has combined with some other compound. So, this value tells you are going to be a clinician And this value tells you that how much iron is bounded to transferrin. Transferrin saturation is decreased with iron deficiency. I have just told you iron is not present, therefore the saturation will not be there and the transferrin saturation will be decreased. If the iron level and the transferrin saturation are high, the TIBC, UIBC and the ferritin are normal, right? Then person are normal, then a person is suspected with iron overdose poisoning. Now you see there is a condition here. If the iron level and transferrin saturation are high, okay? Iron level is high and the transferrin saturation is also high. But the total iron binding capacity, unsaturated iron binding capacity and ferritin are normal. This will indicate that there is an overdose of iron because iron level and transferrin saturation are high. How you can calculate the transferrin saturation? Transferrin saturation is serum iron concentration divided by the total iron binding capacity into 100. And you can see that transferrin saturation, it is expressed as percentage and normal value is 16 to 50%. In iron deficiency anemia, it is less than 16%, and this indicates that there is a iron, inadequate iron for erythropoiesis. Iron overload greater than 50% for men. If this value comes greater than 50%, it means there is a iron overload. And if value transferrin saturation, it comes greater than 45% for women, it means there is a iron overload. Transferrin index, serum iron concentration divided by TIBC. So if we don't multiply it by 100, we'll get the transferrin index, and if we multiply by 100, we'll get the transferrin saturation. Serum ferritin. In certain conditions, plasma ferritin concentration is high. What is ferritin? Storage form of iron. And binds significant amount of iron. In such conditions, transferrin assessment is misleading. In males, 20 to 250 microgram per L. In the female, it is 15 to 150 microgram per L. Plasma concentration below 10 microgram per liter indicate iron deficiency. So ferritin is a stored form of iron. You have seen in the first lecture. And then the ferritin, it then complex with one another and it forms hemosiderin, and both of them are the storage form of iron. So if the plasma ferritin concentration is high and binds significant amount of iron, in this condition the transferrin assessment will not be correct. What is the serum ferritin concentration? This 20 to 250 microgram per liter in males and 15 to 150 microgram per liter in female. And below 10 microgram per liter indicate iron deficiency. High concentration of plasma ferritin. Obviously, it is very clear iron overload will be there, plasma ferritin will be high. In certain inflammatory conditions it is high, malignant and liver diseases. Now we come to the second part of the lecture, that is the physiological factors affecting the plasma iron concentration. Sex difference. Plasma iron concentration like those of hemoglobin and RBC count are higher in men than as compared to the females. And this is due to the hormonal reasons. Androgens increase the plasma iron concentration and estrogens lower it. Androgens is the male sex hormone and estrogen is the female sex hormone. Random variation. These are associated with the physical and mental stress. That is, they are not fixed. It can be higher or lower. Di, diurnal rhythm. That is, the plasma iron concentration is higher in the morning as compared to the evening. That is, it changes with the period of the day, with the time of the day. If the subject is less awake at night, the difference is less marked. Conditions associated with iron deficiency. Hypochronic RBC having less hemoglobin, microcytic anemia, small hypochronic RBC. So what do you mean? ये मैं आपको इसलिए बना रही हूँ कि अक्सर जब when you go through the blood report of anyone, then you should be aware of the terms. What is hypochronic RBC having less hemoglobin? What is microcytic small RBC and having less hemoglobin? Reduce amount of the stainable bone marrow iron, right? Plasma ferritin concentrations are low. These are the conditions which are associated with the iron deficiency. You can go through the first lecture and you will come across the term stainable bone marrow iron. Then the chronic infections are also associated with normochronic normocytic anemia. What is normochronic? Means that red cells have a normal amount of hemoglobin and the color is not too pale or deep in color. And the color is too pale. The color is pale and or deep in color. Not too pale or deep in color. Normocytic means that the red blood cells are normal in size. Iron stores and plasma ferritin are normal or often increased. And anemia does not respond to iron therapy. So, whenever you get the normocytic, so it means that the anemia does not uh, respond to the iron therapy.